Hi guys, we're back. We're going to do a C-spine today. I love spine work, and C-spine is probably my favorite spine to do. Lumbars are awesome too. T-spines are tough, but we get through those. Anyway, we're going to do a C-spine. And so the projections that we're going to do here in our clinic and in the other Sterling clinics is a lateral, an AP axial, and an odontoid. And then if we can't see the C7 T1 joint space, we need to do a swimmers, and we'll show you how to do all four of those. Okay. SID for the lateral is 72 inches, and I'll explain why in a minute. The AP axial, the swimmers, and the odontoid are all done at 40 inches. Okay. Central ray for the AP and lateral is going to be C4. Which is directly below the Adam's apple if you happen to have one of those. But C4 is easy to find. It's right in the midpoint of your neck. So collimation, we want to include it's C1, the tip of C1, or just above the EAM is where we want to be superiorly. Inferior, we want to be able to get the C7 T1 joint space, preferably especially on the AP, we're going to see T1 and T2, okay? Laterally, we just need to get the soft tissues, okay, on both sides. Technique-wise, we're going to shoot them at, between 70 and 74 kVp. I shoot mine at 70. I like a little bit more contrast. Regular sized person, we're going to shoot between 10 and 15 mass, probably. Swimmers is going to be a different deal because we've got to go all the way through the shoulders. So we're going to shoot that one. On a normal size, skinny person would shoot it at 100 mass. Okay. Sometimes you'll shoot your swimmers up around 400 mass. So it's pretty big X-ray. Okay. Tips: remove all artifacts, including glasses, dentures, and earrings. Okay. Those are all going to be in the way of the C-spine. For the lateral, we need to make sure we put our top light just above the EAM, which is your ear hole, just so you know that's what that is. Okay. If a patient is unsteady, they can sit. We do these upright mostly, and they can sit down if they need to do these projections. So like we talked before, if C7 T1 isn't visualized, we need to do a swimmers, and that goes for both the T-spine and the C-spine. So if you can't see the T1 C7 joint space, we need to do a swimmers. Okay. And I remember in school people would say swimmers and people would run away. I actually kind of like them now. Once you get the hang of them, they're not too bad. So anyway, we've got Mikkel on the camera today. Thank you, Mikkel. And we've got Kate Vidito as our model today, and we appreciate that. So Kate has earrings, about 100 of them in that ear, and a necklace on. So we would have Kate remove those, okay? And if they happen to have a tongue ring that's removable, they need to remove that as well, okay? Very important for C-spine that we get artifacts out of the way. Okay. Now you can do these projections in whatever order you want to do them. I start with the lateral just because it's at 72 inches. I'll have the machine set up at 72 inches, and then when we do the AP and the odontoid, we'll move into 40. But I usually start with the lateral. That's what we'll do today, but you don't have to. Anyway, so we're gonna have Kate face the wall over there. Okay, a little hint for you. Set your collimator to a 10 by 12, and on the PAX machine, it's the outside things, okay, outside markers. So we got 10 by 12, and that is going to open your collimation to a 10 by 12, okay, and that's what you're going to be using for a C-spine. It just makes it a little bit easier as far as collimation goes. Okay, so we're going to move Kate's hair out of the way. Now, our central ray is going to go right at the level of C4, okay? You can see right here that we're in the middle of those two places, okay? And if they've got an Adam's apple, it's right at the very bottom of the Adam's apple, okay? Anyway, mid-spine. But for tests, it's C4, just so you know. All right, so we're gonna have the patient relax their shoulders down, okay? And if they have big shoulders, you can use a weight of some sort or a sandbag to help bring those shoulders down so we can see that C7, T1 junction, okay? Anyway, so we've got our central ray, C4, and you'll note that I have light above the ear right here. Here is the EAM. If we have light at the top of the ear, we're in good shape, okay? That's the good thing about opening your thing to 10 by 12 before. Wherever the top of your light is that's where we're gonna get. Usually if you're aiming at C4, we're gonna get the top of the ear, okay? And you can see why we would remove earrings and stuff, because they're definitely in the way. And you're gonna catch the top of the shoulder here, okay? So you'll note that the central ray is moving right up her spine, right? And if you want to get fancy, you can actually turn your collimator box to follow the spine up a little bit more like that, okay? You'll note that we have light posterior and light anterior. So we're going to put our left marker right in front of the person's throat in the light, okay? All right, so we want patient's head straight forward. We don't want them like that or away. Just get them as straightforward as they can, okay? We're going to really relax your shoulders down, okay? And we're ready to take the picture. So we actually do these on expiration. Take a breath in, blow it all the way out, and hold it out. Now, blowing your air out is automatically going to drop your shoulders. So, very important. Okay, so we shoot this picture, bang, you got your lateral, it's beautiful. We looked at the picture and we can't see C7. Okay, so we are going to do a swimmer's view, but that'll be the last one I show you. So, I'm going to have you step out for a second. Okay, we're going to move this into 40 inches. And I didn't tell you why we did the 72-inch lateral, but it's because there's space between the spine and the IR. It's called OID. And in 72 inches, we're going to take away any magnification that causes. Okay, now for the AP axial, we are going to turn the tube 15 degrees cephalic. Okay, and you can see we went from 90 to 75 right there. Okay, and that's 15 degrees cephalic, or heading towards the hen. Oh my goodness. Okay, now remember, if we move that 15 degrees, we've got to move this the opposite way 15 degrees, so this is perpendicular to the floor, right? So we've got that on 15, we've got that on 15, and we're ready to shoot our AP, okay? Go ahead and put your back against there, Kate. Very good. Okay, now be careful, you don't want to blind your patient, but we're going to move that up to the region of C4, correct? Okay, and we've already got our thing open to 10 by 12, right? So, oops, sorry. Sorry. Okay, there's 10 by 12 right there. We did have to change it because of the difference between 72 and 40. Okay, now for the AP, my hands are really cold. I'm so sorry. We are going to match up the jawline right here with the mastoid tip. Now the mastoid tip is a bony prominence right here behind the ear. Okay, we want that to be level between the bottom jaw and the mastoid tip. Okay. Head straight, mastoid tip, and bottom jaw are level, okay? Now, we're gonna mark this either right or left. We're gonna put it in the light over here, or right, so we know that's our right side, okay? And we are gonna shoot this picture, 70 at 12.5 or something along those lines for Kate, okay? Very good, that's the AP. So let's do an odontoid real quick. Go ahead and step out of there. we're going to take our angle away. So we're going to have a perpendicular angle right here. We need to match our tube and our bucky up here. Now I refer to this as a bucky sometimes. It's the IR, okay? All right, so we're gonna have to put Kate's back against there again. This is the funny one that we shoot through the mouth, okay? Now, you can go ahead and collimate down because we're just getting between the teeth, right? And the mid nose and the chin. That's all we're getting. So we don't have to open that up a long ways. Then you're going to bring your crosshairs right to where the opening of the mouth is. Okay. Now, a little bit different this time. We're going to take the upper incisors, her upper teeth, and we're going to make a straight line between the mastoid tip and the upper incisors. Okay. So we're actually going to tilt your head down just a little bit. You can see where that's even now with the upper incisors and the mastoid tip. Okay, that's the level we wanted at. Now, we're going to make sure her head is straight, and we're going to have her open her mouth as wide as she can. Very good. Okay, you can see that we're going to go right through her open mouth, and we're going to get C3 through C1. Okay, so this is an uncomfortable one, so don't make them open their mouth for 5 minutes. Okay, you go ahead and position them with their mouth open, and then go to take the x-ray and have them open their mouth as wide as they can. Okay, and stop moving, all right? And these ones are tough to get sometimes, and you'll get to a point where you get them most every time, but you need to really watch the superimposition of the dens, okay? Make sure they're not superimposed. How would you say that? Superimposed. Okay. All right, let's do a swimmers real quick and we'll let you go. So we're going to come right back in here. Okay, we're going to put the patient's left side against there again. Yep, there you go. Okay, so remember, we're trying to get the C7 T1 junction right here, right? Okay, so we've got to go through 2 shoulders, so we're going to have to really up our technique game. Okay, now to perform this, we need Kate to bring this arm up along her side, just like that. Okay, and she's going to relax this shoulder down. You can see where we've kind of made some space in between there in the area that we're looking at. Okay, it helps us so we don't have to use a huge technique sometimes. If they're able to get those shoulders up out of the way, we're in good shape. Okay, now I've always taught that my central ray is just going to skim the top of the shoulder right here. Okay, and we're going to go right through that C7 T1 junction right here. And you can always tell where C7 is because that's where the prominence on the back of your neck is. Okay, that's kind of the area we're shooting at. We're going to open our collimator to a 10 by 12 again. Okay. I always forget it's the other one. Okay, just like that. All right, so now when we go to shoot the picture, we're going to relax this shoulder down. Okay, we're going to put our left marker here so we know it's left lateral. Okay, and we're going to shoot this. Now in Kate, I would probably shoot this 70 kVp at probably 250 mass. Okay, give that a shot. You can go ahead and relax now. Just have the patient hold still and hold their breath if they would like to. Okay. In this picture, you need to be able to try to see C7 and T1. Okay, sometimes it's tough to do, but sometimes you have to use a pretty high technique to get through there. Okay, I hope this was helpful. C-spines are awesome. Once you get doing them and know what you do and what to look for on the images, it's pretty awesome. So anyway, thanks for coming today. I appreciate it. We'll get more out. I've got somebody wanting me to do an ankle, so maybe we'll do that one next. So anyway, I appreciate your time. Hope this was helpful. If you have any questions, please reach out to me. Okay, a couple questions for this one. So if we are unable to see C7 or T1 on our lateral, what do we need to do? There's a special projection that we need to take care of. What is that one called? And why do we do our lateral C-spine at 72 inches? We did talk about it, so listen close. Okay, thanks guys. See ya.